Lung cancer is the leading cause of cancer deaths worldwide, claiming more lives each year than breast, prostate, and colon cancers combined. But what makes lung cancer so deadly? Often, it's the silence with which it begins its invasion. Today, we're diving deep into the critical importance of recognizing lung cancer signs early. Despite its deadly outcomes, lung cancer doesn't have to be a death sentence. Early detection can dramatically increase survival rates, making awareness of its signs crucial. One of the biggest challenges in battling lung cancer is its stealthy nature in early stages. Many who suffer from this disease don't show symptoms until it's advanced. That's why knowing the warning signs is more important than ever. Number 1, persistent cough. A persistent cough, often trivialized as a minor ailment, can be a crucial early warning sign of lung cancer when it lingers beyond the typical duration for a common respiratory infection, which is usually around 2 to 3 weeks. This type of cough might manifest differently from the usual cough associated with colds or allergies. It could either be non-productive, dry, or productive, phlegm-producing, but its defining characteristic is its persistence. The cause behind this symptom in lung cancer patients is often rooted in physiological changes within the bronchial tubes. As tumors develop and grow, they can obstruct or irritate these airways. The body's natural response to such obstruction or irritation is to cough in an attempt to clear the blockage and soothe the irritation. Unlike common colds where the cough subsides as the body recovers, a cough linked to lung cancer remains persistent, can worsen over time, and is often resistant to conventional cough remedies like syrups or over-the-counter medications. Moreover, a persistent cough in the context of lung cancer might be accompanied by other alarming signs such as hemoptysis, blood in the sputum, changes in the color and consistency of phlegm, and progressive difficulty in breathing. These symptoms signal the severity of the underlying issue and necessitate more than just casual observation. They require immediate medical evaluation. The biological mechanism of a cough related to lung cancer involves more than just physical blockage. Tumors pressing against and irritating lung tissue can also trigger the cough reflex. This complexity means that any persistent cough that does not resolve with usual care, especially when accompanied by other symptoms of lung cancer, should prompt an immediate consultation with a healthcare provider. Diagnostic tests, such as chest X-rays or CT scans, are essential to ascertain the presence of tumors or other anomalies in the lung that might be causing the cough. Thus, it's imperative not to dismiss a persistent cough as a harmless condition. In cases of lung cancer, recognizing and responding to this symptom can be a critical step in early diagnosis and treatment, potentially improving outcomes significantly. Number 2, changes in breathing. Changes in breathing can be a subtle yet significant early warning sign of lung cancer. Deserving careful attention and understanding, this symptom manifests as shortness of breath, wheezing, or a noticeable struggle for air, which may initially occur only during physical exertion but can progress to affect the individual even during periods of rest. The underlying mechanisms causing these changes are often multifaceted, involving both direct and indirect effects of lung cancer on respiratory function. Tumors located in the lungs can physically obstruct or narrow the airways, making it difficult for air to pass freely. This obstruction not only affects the volume of air that can be inhaled, but also the efficiency with which oxygen is exchanged in the lungs. As tumors grow, they can also exert pressure on surrounding lung tissue, further impairing the lung's ability to expand during inhalation. Additionally, lung cancer can affect breathing by spreading to the pleura, the two-layered membrane surrounding the lungs. When cancer cells invade this membrane, they can cause pleural effusion, a condition where fluid accumulates between the layers of the pleura, compressing the lung and reducing its capacity to expand. This fluid buildup can significantly contribute to the sensation of breathlessness experienced by patients. Moreover, lung cancer may also impact the nerves or muscles involved in the respiratory process. Tumors pressing on nerves that control the diaphragm or other respiratory muscles can weaken these muscles, decreasing their ability to help expand and contract the lungs effectively. Given the gradual onset and progression of breathing difficulties in lung cancer, it is crucial for individuals experiencing such changes to seek prompt medical evaluation. Diagnostic tools such as pulmonary function tests, chest X-rays, and CT scans can help identify the presence of tumors or other abnormalities causing these symptoms. Early detection and treatment of lung cancer can significantly improve respiratory function and overall prognosis, highlighting the importance of vigilance for any changes in breathing patterns. Number 3, chest pain. Chest pain associated with lung cancer can manifest in various forms and is often misunderstood due to its common occurrence in less severe conditions. In the context of lung cancer, chest pain is not merely a localized discomfort, but a complex symptom indicating potentially serious underlying abnormalities. This pain may present as a sharp, stabbing sensation or a dull, persistent ache, frequently exacerbated by deep breathing, coughing, or even laughing. The mechanisms leading to chest pain in lung cancer patients are diverse. One primary cause is the direct invasion of lung tissue and surrounding structures by the tumor. As the tumor grows, it can infiltrate the pleura, the thin membrane that lines the lungs and chest cavity. This invasion can lead to pleuritic pain, which is sharp and worsens with respiratory movements. Another mechanism is the involvement of the chest wall or ribs, where the expanding tumor exerts pressure or causes erosion, contributing to the pain. Furthermore, lung cancer can metastasize to the bones, including the vertebrae and ribs surrounding the thoracic cavity. Bone metastasis can result in severe, persistent pain, signaling advanced disease. Additionally, tumors located near the apex of the lung, known as Pancoast tumors, can specifically cause severe pain in the shoulder that radiates down the arm, due to their proximity to nerves and blood vessels in the area. Given these complexities, any new, persistent, or worsening chest pain should prompt immediate medical consultation. Diagnostic imaging like CT scans and MRI, along with bone scans, can be instrumental in determining the extent of the disease and the specific cause of the pain. Recognizing and understanding the significance of chest pain in the spectrum of lung cancer symptoms is critical, as it may indicate both local progression and distant spread of the disease, underscoring the necessity for timely and comprehensive evaluation and management. Number 4. Unexplained weight loss. Unexplained weight loss in the context of lung cancer is a significant symptom that often goes unnoticed until it becomes substantial. This phenomenon, known medically as cachexia, involves not just the loss of fat but also a deterioration of muscle mass and overall body strength. It is a serious clinical condition that affects up to 60% of lung cancer patients at some point during their illness. The mechanisms behind cachexia in lung cancer are complex and multifactorial. Cancer cells consume a large amount of the body's energy resources, and the immune response to the tumor further increases metabolic demands. Additionally, substances produced by tumors can interfere with the normal metabolism of fats and proteins, exacerbating the loss of body mass. This metabolic disruption is often compounded by decreased food intake due to decreased appetite, which is common among cancer patients, often related to both the psychological impact of a cancer diagnosis and the physical effects of the tumor itself. Moreover, cytokines and other inflammatory mediators released by the tumor or by the body in response to the tumor can directly cause muscle wasting and disrupt normal appetite-regulating pathways in the brain. The net effect is a profound energy deficit, where calorie intake does not keep up with the body's increased metabolic needs. Given these underlying causes, unexplained weight loss should always be taken seriously and evaluated in the context of other symptoms. It is often a heralding sign of advanced disease but can also be an early indicator in tumors that are metabolically active or aggressive. Diagnostic assessments typically involve a thorough evaluation of nutritional status, metabolic function, and imaging studies to assess the extent of the cancer and any possible metastasis. Managing this symptom in lung cancer patients requires a multidisciplinary approach, including nutritional support, possibly pharmacological interventions to stimulate appetite, and management of the underlying cancer itself through appropriate therapies. Addressing weight loss aggressively is crucial, as it can significantly impact the quality of life and overall prognosis of lung cancer patients. Number 5. Hoarseness or wheezing. Hoarseness or wheezing in the context of lung cancer is an often overlooked symptom that can signal significant underlying changes within the respiratory system. Hoarseness typically results from an impairment of the vocal cords, which may occur if a lung tumor affects the nerve pathways that control the voice box or larynx. The nerve most commonly implicated is the recurrent laryngeal nerve, which can be compressed or invaded by tumors in the chest, particularly those located at the top of the lungs or along the pathway of the nerve. Wheezing, on the other hand, is a high-pitched whistling sound produced during breathing, when air flows through narrowed or obstructed respiratory airways. In lung cancer, wheezing may occur if a tumor grows large enough to press on or block a portion of the bronchial tree, the system of airways leading into the lungs. This blockage can occur with tumors that are centrally located near the large airways of the lungs. Both hoarseness and wheezing are critical symptoms because they can indicate both the presence and the location of a tumor. These symptoms may appear before any other overt signs of lung cancer, making them valuable for early diagnosis. Unfortunately, because they can also be symptoms of less severe conditions, such as bronchitis or laryngitis, they are not always immediately linked to lung cancer, which can delay diagnosis. Diagnostic evaluation for patients presenting with hoarseness or wheezing generally involves imaging studies such as a chest X-ray or CT scan to visualize the tumor's impact on lung structures. Bronchoscopy can also be used to look directly into the airways and assess any obstruction. Additionally, if hoarseness is present, an examination by an ear, nose, and throat specialist, ENT, might be warranted to evaluate the vocal cords and larynx. Addressing these symptoms promptly is crucial. Not only does it facilitate an earlier lung cancer diagnosis when treatment may be more effective, but it also aids in ruling out other potential causes. In managing lung cancer-related hoarseness or wheezing, treatment may include interventions to reduce tumor size or remove the tumor if possible, alongside supportive therapies to help maintain airway function and vocal cord health. Recognizing the early warning signs of lung cancer is critical for improving treatment outcomes and survival rates. The key signs to watch for include a persistent cough that does not resolve with typical remedies, changes in breathing such as shortness of breath or wheezing, chest pain that worsens with breathing or coughing, unexplained weight loss, and hoarseness or wheezing that affects your voice. These symptoms may often be mistaken for less serious conditions, which can delay diagnosis and treatment. Early detection of lung cancer significantly enhances the effectiveness of treatment, potentially leading to better management and survival rates. Therefore, it is vital not to dismiss these warning signs, regardless of their severity or your prior health history. If you or someone you know is experiencing any of these symptoms, it is crucial to consult a healthcare professional immediately. Share this video with friends and family to spread awareness about the importance of early detection of lung cancer. Prompt action can save lives.